everything you thought you knew, it's time to think again. Hello, Anja Angels. Welcome back to another vlog. Today we're going to be debunking 5 major pregnancy myths. The first myth has to do with the fact that you're eating for 2. A lot of people always think that they're eating for 2 when they're pregnant, and so they eat a lot more. But in reality, someone who is pregnant only needs 200 additional calories in a day. So you don't necessarily need to be eating twice as much as you normally do, but of course you shouldn't feel guilty about giving yourself a little extra goodies here and there and eating more, of course, throughout your day. So whenever you get those pregnancy cravings, then definitely try and satisfy them. There's sort of no reason not to. Right now is a time when you can definitely allot yourself that additional snack. So definitely take that on if you feel like it. Okay, myth number 2, this one is for all you coffee drinkers out there. A lot of folks think that if you're pregnant, you can't have any coffee at all. In fact, I remember Dr. Sterling, the OBGYN influencer, once made a video talking about how a waiter at a restaurant basically openly judged her for consuming coffee. And she corrected them that not only was she pregnant and she had been pregnant before, but she's an OBGYN and of course has this large platform where she talks about pregnancy information, health, and tips. And in that, she told her audience that it is indeed okay to have coffee if you are pregnant. So one big myth is that you can't have any coffee at all, but there are a lot of questions around how much coffee you can actually have. So today I'm gonna tell you how much coffee you can have. Basically, according to Penn Medicine and Dr. Sterling's post and ACOG, the American College of Obstetricians and Gynecologists, you want to try and limit your consumption to less than 2 6-ounce cups per day. So if you want to put it into perspective, 6 ounces is roughly the styrofoam cups that you get at events or that you may see in offices or anything like that. So you want to have a little bit less than those 2 6-ounce cups. That's pretty much the limit. Myth number 3, I'm bringing in Placenta, my placenta and umbilical cord plushie, to talk about this one. But a common myth is that you can encapsulate your placenta and basically put your placenta into pills and eat them in order to reduce postpartum depression and anxiety. However, there's very, very limited evidence behind the idea of placenta encapsulation. A lot of folks believe that it really originated in sort of the hippie movement around the 60s and 70s, and the research that has been done on placenta encapsulation demonstrates that it's more or less a placebo effect. And in fact, there are people that have encapsulated their placenta and consumed it and then got an infection from that placenta consumption. So that's definitely something to be aware of. You want to make sure that everything you're doing is an informed choice. So definitely be sure to watch out for that. And so instead, what you can do with your placenta is potentially use a company like Anja Health. Maybe I'm a little bit biased, but basically what Anja Health does is we send you a kit that you can bring with you to birth to be able to put your placenta and umbilical cord in jars and collect blood from inside of your umbilical cord. Then you can call us for pickup. We will come to wherever you are in the United States and bring it to our lab. And our lab technicians will process and cryopreserve stem cells from your umbilical cord and placenta so that you can use them in the future. And that is actually an evidence-based process because folks have indeed used both umbilical cord and placenta stem cells to treat things like different types of cancers like leukemia, type 1 diabetes, HIV, multiple sclerosis, and the list goes on and on. So this is something that I wish my family did because my brother needed cord blood stem cells when he was diagnosed with cerebral palsy. So I just wanted to give a quick plug for that. Not a lot of people even know about it, so I wouldn't even call it a myth. It's just something that people don't know about and that there should be more awareness around. So definitely consider that if you're giving birth soon. Myth number 4 is around bleeding during pregnancy. So a lot of folks think that if they're bleeding in their first trimester, it means that they're having a miscarriage or that they're experiencing something really, really fatal. However, vaginal bleeding is actually extremely common in your first trimester, and it happens to about 20 to 40% of those who are pregnant. So if you are experiencing vaginal bleeding, then you definitely still want to consult with a physician because you want to make sure that everything is all right, but it's not necessarily a reason to panic because it doesn't per se mean that something is really wrong. It might actually mean that you are just experiencing something normal. Basically, it happens around the time that your period would be due anyway, but as mentioned, this is not medical advice, and you definitely want to consult with a provider about any vaginal bleeding that you're experiencing or anything out of the norm in general. And lastly, myth number 5 is that you cannot get pregnant on your period.
Have you had sex today? Mom, shut up. Are you telling me that if you don't have sex, you can still get pregnant?
Yes, because sperm lives inside the vagina for 3 days.
Who taught you this? She went to school, and you should be happy your daughter has an education, especially sex ed. You obviously didn't. That's why you have multiple baby daddies and thousands of children. Oh, hey.
So sperm can live in the vagina for many days. A lot of folks say that they can live in the vagina for up to 3 days, but in fact there are studies that demonstrate that sperm have a 5% probability of surviving more than 4.4 days and a 1% probability of surviving more than 6.8 days, which is a crazy amount of time. And in that time, you may indeed be releasing an egg if you're on the last day of your period, for instance. So this is definitely something to be aware of. A lot of folks do already know about that myth. So one last bonus myth that I wanted to debunk is that breastfeeding and an emotional connection with your baby happens right away. This is a really common myth, and not a lot of people talk about the fact that it's actually not true. We should really be normalizing both postpartum depression and anxiety, and we should also be normalizing not having an immediate connection with your baby. In fact, for a lot of dads, this is something that is really undermined. A lot of fathers don't feel like they can open up about the fact that they don't feel connected to their baby right away. And I've even read experiences and anecdotal stories where dads talked about not feeling connected until their baby smiled for the first time, which doesn't happen until around 5 weeks or so. And even then it could just be gas, but that's when they first begin to feel that connection. But in the meantime, things like skin to skin and just following your own instincts is really something that you can do, and also rely on community. Community is really important. 4 in 5 maternal deaths are preventable, and that's largely because a lot of them are due to mental health issues. So this is something to really keep an eye out for. If you are currently pregnant, definitely try to prepare yourself to have a support system if you can, even if it's online friends or anything like that, or someone in the Anja Health community, for instance. We definitely recommend finding folks that you can lean on, because during this time you could potentially expect a lot of happiness and joy, and some parents just don't feel that. But it's honestly really normal and not talked about enough. So definitely stay safe and stay loved. Make sure to love yourself and bring yourself love when you need it. Hello, Anja Angels. My name is Kathryn. I am the founder of Anja Health, so I wanted to personally thank you for watching this video. If there were any specific moments that you liked, then we ask that you comment the timestamp of that moment in the comment section. And of course, like and subscribe if you like this video. We have a ton more pregnancy and parenting and birth provider resources on this channel, in addition to our other social channels. You can find us on Facebook at Anja Health, on Twitter at Anja Health, on TikTok at Anja Health, and at Kathryn Anja. That is my personal TikTok where I talk about Anja Health. You can also text us at 310-620-1663. Yes, it is always a real person. And lastly, we have a free community for those that are interested in pregnancy, birth, or cord blood banking. So you can join us there at anjahealth.com/community. And then lastly, we have a podcast, the Better Birth Podcast by Anja Health. So we would definitely love to meet and see you on any of those channels, whichever one is your favorite. Once again, thanks for watching, and hope to see you at our next video.